Dr. Alex Rosa. Let's get into today's episode. Welcome to In Your Business with Dr. Alex, where we get all up in your business and your health. Enjoy live interviews and solo sessions with experts in business and health, featuring your host, Dr. Alex Rosa. Let's get into today's episode.
Hey, welcome to today's episode of In Your Business with Dr. Alex, where we get all up in your business and your health. And today we're going to be talking about specifically pelvic floor health for women over 40. So if you are a woman over 40, or if you know a woman over 40, you know what you need to do. You better tag them, send them the link to this episode, because we're going to be talking about some very important things when it comes to pelvic floor health and your health overall, and how it pertains to women over 40 and how it could be impacting your life and you don't even know it. So I have an amazing guest with me here today. I'm going to bring her up on the stage here in a moment. And if you are tuning in, let us know in the chat where in this whole wide world that you are joining us from, what platform, what you're up to today. If you're having a great day, which I hope you are, then let us know. We'd love to say hello to you and bring you into this conversation. We welcome questions, right? This is interactive. Don't just sit on the sideline. Go ahead and send us a little message, say hello, and we'd love to give you a shout out. So let's get into it. Let me bring my gorgeous guest up here, Miss Ingrid. How are you?
I am doing great. Thank you, Dr. Alex, so much for having me on. I can't wait to get some great information out there.
Fantastic. I'm going to switch us around on the screen here. There we go. Doing a little magic here. You know, and I was just checking out my chat settings, and for some reason, my chat little thing is not coming up. So if you happen to see questions or anything, I don't know if you're able to see them or not, let me know. That sucks. I don't know what happened. It says a network change was detected, and it's not letting me see chat messages. I don't know. All right. Well, we're going to go with it. We are going to continue. All right, Ingrid. So, and actually, I want to get rid of this too. I'm doing like little things while we're here. So, Ingrid, why don't you even start us off with what is pelvic floor health? Like, what is that? Because we were just talking off screen here before the show started, and we're like, do women even know what their pelvic floor is? So tell us a little bit about that.
Yeah, unfortunately, most people don't know what their pelvic floor is. And it's really a shame because it kind of prevents people from getting care that they need. So a pelvic floor is a big term for the musculature or the musculoskeletal system that sits at the bottom of your pelvis. And the pelvic floor has lots and lots of jobs. So for instance, one would be supportive. So it holds up all your organs all through your life. So whether you sneeze, you cough, you lift, you're on the trampoline, it doesn't matter. That pelvic floor has got to hold everything up, right? And then the next one is what's called sphincteric. So basically we have circular muscles that are around our urethra where we urinate or pee from, and our anus where we poop from. Those should be closed when we don't want to pee and poop, and they should be open when we do. But unfortunately, if they get weak, they can suddenly open and we might have leakage of some sort, right? So that's another important job. And then there's the sexual function, which is hugely important, and that allows us to have intercourse and enjoy intercourse. So there's two very important components right there of our sexual health that the pelvic floor really is a big, big part of, yet most people don't know that. You know, they don't know at all that our musculature has anything to do with sex. Yeah. And then there is what we call a sump pump, you know, so in other words, the pelvic floor can pump fluid out and keep that fluid from kind of congesting in the area. So that's very important. And then it has a job of putting all of our stability together. So notice those are all S's. We call them the 5 S's. And it's just what helps our whole core. And that's a whole subject in itself, what the real core is. But it helps the whole core function together. And it's what people don't realize, I think I want to do my 6-pack, right? And that's my core. Well, that is so wrong. That is actually the least important part of our core, and our pelvic floor, which is like the foundation of our house, is the most important part. So we look at 5 big functions that we need every single day, and people do not recognize it. So lots of work, lots of effort, little recognition. That's what I feel like the pelvic floor is.
Yeah, it's so vitally important. It's so deep in there as well. And I think you touched on something so important where you mentioned the whole thing about the 6-pack. And this is like a lot of the content that I talk about as well. A lot of those like superficial things, like we want things to look a certain way, but then we don't really understand, well, there's many layers, both, figuratively and actually. There's so many layers deeper that you need to really think about and consider. A 6-pack is visually whatever. It's appealing to some people. I'm not even going to say everybody. Not everybody finds a 6-pack attractive, but it's kind of like that standard or that goal that so many people have. And that's what they think about. Like they think about healthy, right? And then they think about, 6-pack. When no, not actually, because there's so many layers again underneath that, and that pelvic floor is such a huge component about that. And you talked about stability in our core and being able to stand and move around and function, and that's such a huge part of that. Do you find that, especially when we're talking about women over 40, and there's kind of like 2 categories, right? Like there's women who have had children and there's women who have not had children. Do you kind of see a difference between pelvic floor issues between women who have had children and women who have not?
There is some difference. So having children, both being pregnant and vaginal deliveries, there is more force and irritation to the pelvic floor. There's an increase, I'll call it an increased risk of getting a pelvic floor problem, but it doesn't mean that if you haven't been pregnant or you haven't given birth that you won't have the problems either, right? So it's that kind of thing, like people, well, I haven't had pregnancy, so I'm not going to have those problems, when they can indeed have different problems. Like I said, just the risk factor goes up a little bit just because our bellies have been stretched, right? So the abdominals get stretched. It's harder for them to get back. It doesn't mean they can't. And then the pelvic floor has that weight. Remember, we were talking about supportive, right? So I like people to think of their pelvic floor like a sling or a hammock at the base of their pelvis. And if you think of a sling or a hammock, you think, okay, I've got weight in that sling or hammock. And if I have a lot of weight continue, let's say I've had 5 pregnancies, then I'm going to have that 5 times force on the pelvic floor. So my risk of getting weaker, getting stretched, or reflexively tightening, which is an important concept that we can talk about, then we may be at a higher risk for having a problem.
So talk about that a little bit more, because I've never heard of that. What is that?
So what happens a lot of times is our pelvic floor is designed to be able to contract and relax like any muscle. So the muscles in our pelvic floor are the same kind of skeletal muscles as any muscle in the body, which means we can exercise them. They can get injured. They can have surgery. They can have scar tissue. Anything that happens somewhere else in the body happens in the pelvic floor. The difference is those 5 functions I talked about, it impacts so many more things in our life than many other muscles do. And they're hidden. We don't see them. So what happens for some folks is we may get that stretch, we may get that weakening, and that's where something like incontinence might show up. All right, as an example. Okay. But what we don't realize is that pelvic floor can also tighten, meaning the muscles can get They can get shorter. They can get to the point where they can't function the way they should. When that tightness occurs, we can get pain at the pelvic floor. We can have pain with sex. We can have pain that radiates out to our hip or our back. So the pelvic floor can influence so many other structures within our entire pelvis because it is part of that core that we talked about. Now you can start to see some of those tie-ins that we talked about, right? That the pelvic floor doesn't exist by itself. It is part of a beautiful big structure in our whole pelvis that affects all genders. We're talking about women because we're at a higher risk, but men, they can have these problems too. Yeah. So that tightness that we just talked about is so important to people to realize that they should be aware of whether they have just weakness, tightness, or both at the same time. In fact, so many of my patients actually have a tightness and a weakness at the same time, because tight doesn't mean strong. Tight means poor function. And if I can get people to understand that concept, I think that helps a lot with understanding how you can have this happen at the same time.
Yeah. That makes me think of like when people say your muscles are tight, like where you need to stretch out or anything like that. Like when your muscles are tight like that, you're not going to be able to perform or function very well. So that's an interesting concept to apply. Same thing to your pelvic floor. Because I think women, especially like if we're talking about like sex or anything like that, like keep it tight, like tight. That's what people think of. But in this case, no, we don't want things tight. That means they're not really functioning very well. So I think that's an important concept.
Yeah. I like to use what I call the biceps analogy. So basically, if I were to do this with my biceps, that would mean that I'm using that biceps. If I do that 24/7 or 24 hours, at the end, someone would have to kind of help me straighten the arm out. It would be uncomfortable. If I do that 24/7, after a while, the arm will only function in a small range. It loses its ability. Now, I would never walk around all day long with my arm like this because, it would look kind of funky, right? But at my pelvic floor, if I'm doing that, I don't know I'm doing it, right? And then it becomes cyclical and it gets tighter over time.
Yes. So I know you mentioned, excuse me, I know you mentioned I kind of wanted to get into problems because I know you mentioned some issues like incontinence. You mentioned like back pain, some other things. So can you kind of list out some things like if women were having these issues, and I often find with women, like in my practice too, there's these mysterious things that are happening, but in actuality, there is a cause. There's always a cause, but we just don't put the two and two together because it doesn't seem like it's directly relational when all the things in our body are always, related. But can you maybe help women put the pieces together between maybe list out some symptoms or things that they might be experiencing that really are pelvic floor related and maybe they just don't realize it?
Yeah, I'm so glad you said mysterious because it is why I titled the book, The Musculoskeletal Mystery, How to Solve Your Pelvic Floor Symptoms, because it is a mystery for so many people, quite honestly, right? So the book does a great job, like talking a little bit about what those diagnoses are and how it links to the musculoskeletal system. But for today, what we'll talk about is the first example, because people are a little more familiar, is urinary incontinence, which could be stress incontinence from sneezing, coughing, jumping, that kind of thing. And then there's urge incontinence where, oh my gosh, I'm not going to make it to the bathroom on time, which can be really life-changing for some people. And those symptoms basically are sneezing, coughing causes leakage, or I can't get to the bathroom. And then eventually I have leakage on the way to the bathroom, right? So that's one category. Fecal incontinence is what a lot of people really don't want to talk about. And it's much more common than people think. It can occur right after pregnancy, especially with like a forceps delivery or so forth like that. And it can happen later in life, especially during menopause. So as you get through those perimenopause and menopausal time periods, fecal incontinence risks increase. And that could be a little bit of a loss, which means you might get a little stain on your underwear. Or it could be a major loss, like a big embarrassment for some folks when that happens. Then we have something called prolapse. And here's something, this is super, super important for, your ladies who are 40 then over and over. Sometimes prolapse happens during and right after pregnancy, and it can go away, but comes back during menopause. And what that is a pressure of one of your organs, meaning your uterus, your bladder, or your bowel, into the vaginal canal, and then the vaginal canal wall starts to push out through the vaginal opening. So it appears as a bulge, pressure. It can be uncomfortable. Sometimes it's painful. That's not a major hallmark, but it can be painful. But it can feel very disruptive, and people feel like, oh, I can't have sex now. What is this? Is it cancer? People get scared. And there's where you really need to go to your OBGYN to have it assessed, or a urogynecologist who can assess it. And it's very treatable in a lot of different ways. And then we have something that I think, unfortunately, most people don't relate to the musculoskeletal system, and that's pain with sex. And this is so sad because people go through life thinking, well, I just have to deal with it, or I'm going to stop having sex, or I have low libido, and they don't realize the low libido is because every time they even think about sex, it's like, that's painful. I don't want anything to do with that. And it becomes so cyclical when just treating the muscles can completely solve the problem, or working with another medical practitioner to work on other components that happen, especially during menopause, with a physical therapist will then help that person get back to a comfortable and enjoyable sex life. And it's so doable, and it's so sad that so many women just live with this and feel like, well, it's part of menopause, so I'll just deal with it. And it's so unnecessary. So those are some big things. And then that can also contribute to back pain, hip pain. I've had a lot of women come into me and say, Ingrid, I was diagnosed with hip bursitis, and we work on their pelvic floor, and their hip bursitis, quote unquote hip bursitis, goes away. It was never hip bursitis. It was the pelvic floor contributing to the hip pain, right? So you can see it's really a very large category. And I can go on and on. I mean, there's more, but those are major subsets. Endometriosis falls under pelvic pain, and what's called vulvodynia falls under pelvic pain. So pelvic pain itself is a category we could talk about for a couple hours, quite honestly.
No, that's all fantastic. And that's why I said, like, that area, there's so many relational things that are impacted by that, but so many women don't realize that because they just get focused on like the one area, like it's isolated. And I think that's what we often forget about our body, is it's all connected. It's all connected. One thing is always going to impact another, which is going to impact another, and it all kind of cascades and waterfalls. And I think that's why I always focus and preach and talk about, just overall health, overall wellness. Because if you can keep this kind of in pretty good shape, the likelihood or the risk of you to have other complications, other issues really lessens. It really decreases the overall, if you can keep your overall health in check, you absolutely can. But I know for women, we have all these like little special pieces and parts inside of us, and they always like to kind of do their own thing sometimes. And you brought up so many good points about, especially after a certain age, with these different hormonal changes. And I think too, with like the hip bursitis or back pain, many times, and this is what is so sad about women's health, is, we'll go in to a provider, to a doctor, to whoever with these complaints of pain. And it's like, well, take these pain pills, take these pills, do this, let me throw a shot in there. Like, that's always the first go-to, instead of thinking more of your body as a system and individualizing that attention and really thinking about, well, you're a woman and this is what possibly else could be going on. And there's other ways that we can treat this. There's other things that we can do, other modalities that we can try. Just like you mentioned, going through with PT or addressing other health concerns that could be impacting that part of your body. And I think like for women, it's so hard for us to speak up in the first place. If we're having these intimate issues or any kind of issue down there, it's very difficult for us to want to even say anything. And then to advocate for ourselves. So I like that you listed that out in that way. And I love with your book too, it's so detailed that women can be like you could take it to somebody and be like, look at this. I need some help around this. Like, what can we do for this? That's what I absolutely love and I appreciate about your work so very much.
And I'm glad you said that because the book is lightweight. It's a paperback lightweight book. It's small enough you can stick it in your purse if you want to. And I made it so that you could literally take it to your practitioner and you can open it up and say, see, this is what's going on and this is where I need help. So it validates the person. It helps them take that step. I always say the book is for you and your loved one because it's not necessarily you who has the problem, but it may be a loved one. Do you know that 1 in 3 women have a pelvic floor disorder in the United States? And that number increases the older we get. So any of those things that I just talked about or combination of those things affect so many women that, you're bound to know someone else who needs the help, but doesn't know how to reach out to get that help, right? So that's what I wanted to do with this book is I felt like it was so, so important after me seeing it took 5, 10, and 30 years for a patient to walk in my door because they didn't know what to ask for and the practitioner didn't even know that pelvic floor PT existed. It's getting better, but boy, do we still need work on that to get people the help when they need it instead of waiting for years for it.
Mm-hmm. Yeah. Instead of having to just deal with the symptoms, like we're told, like, oh, well, it'll pass or it'll whatever, just deal with it. It's a part of life. It's part of your age. No, it's not. It's not. I think every woman should be able to have that conversation. They should feel safe enough to have that conversation. And they should know that they just don't have to deal with things. You're just not a part of aging or getting older, or you're just a woman, so you got to deal with it. I think that's such bullshit. Like, there's so much we can do for our health, and that so many times, right? And that's what's also is sad, but so important about the work that both of us do is, so much of the things that can really help us don't fall under traditional, methods of care or what so many providers, and myself included, are never taught about in school, because it doesn't generate revenue for certain industries, and the things that we endorse or the things that we practice, the things that we know can help people, they're not really the biggest revenue generators for all of those companies. And so it's such a disservice. But again, it just takes people like us to talk about this on platforms like this so that women know that there is help out there. And with your book and with all the amazing work that you do, that's what we need right now.
Yeah.
And
gosh. Yeah. It's for me, what I've, as a pelvic physical therapist, I've been a therapist for 39 years and a pelvic PT for 27 because it didn't really exist when I started. And it was a long road to get all that information and really build it. And it's better. We have residency programs. There's a lot now going on. But I guess what I always fought for is an interdisciplinary care model, meaning we all work together, right? We all work together for the patient. It shouldn't be, I'm just going to do this. I can't tell you how many times I've referred out to sex therapists and acupuncturists and, chiropractors, whatever that patient needed to pull the care together. And, I felt like if I can get the message out about interdisciplinary care, and there's a whole chapter in there about team, like how do you put everybody together? What does it all mean? Who are all these people? And why would I need them? So it's a really start to finish in the book. It describes like, what do you get in a pelvic floor examination from a physical therapist? What do you get in treatment? What are self-care things? How do you start your care? All of that. So I felt like if I could just get that message out there, then, and like what you're doing, like you said, you're getting that message out there to people where they didn't know about this before. And we're empowering people to take care of themselves and their loved ones. That's what I'm all about. That's what I hope to do every single day.
Yes, I love that. And you kind of touched on some things that you talked about self-care. You kind of mentioned a sex therapist. You mentioned some other people. Are there any just general blanket overall practices or routines or things that women can do if they've kind of heard what we've talked about, they kind of identify that they have some type of pelvic floor issue and they want to be proactive like today about it. Can you recommend a couple things for women?
Yeah. So, I mean, a big overarching kind of, I guess I'll go very healthy thing or self-care thing to do is being outside and something like walking, an easy activity. Because if you start to tell people, you need to go to the gym and do a 3-hour workout, how many people are going to do that, right? So I always tell people, start with something you enjoy doing. It could be gardening, it could be walking, it could be all those things. So I encourage people to stay active because the pelvic floor acts. Everything you do, every step you take, every breath you take, the pelvic floor is active with it. So being sedentary actually is very unhealthy for the pelvic floor. So mild and moderate exercise, which is now being proven, there's lots of research finally coming out how moderate exercise is very beneficial for the pelvic floor. It's when we get into aggressive exercise that sometimes it's not beneficial. Like high level trampoline work, long distance running may be an issue if the pelvic floor isn't treated properly. So notice I said it's not that you shouldn't do it, it's that the pelvic floor needs to be treated properly first. But for your everyday person, moderate level activity is really helpful. Mm-hmm. The next step that I are the more you have at the pelvic floor tissues. So that could lead to pain with intercourse, right? So that's something as simple as that. Sometimes when we have overactive bladder, people tell us, oh, you need to stop drinking. Well, that's the worst thing you can do. That actually irritates the bladder more, right? So good fluid intake. It also helps prevent constipation, which is another huge pelvic floor issue that as pelvic PTs we can treat. People don't think the pelvic floor is involved. It is absolutely involved. So that's another important thing to realize. So fluid intake is another big, large category of something you can do to help yourself. Mm-hmm. If we want to get more specific to the pelvic floor, in other words, I call them pelvic floor contractions and relaxation, not kegels, because people have the wrong concept of what that is. So I assess people coming in the door and they say, I've been doing kegels for years and they don't do anything. And when I assess them, not only are they doing it incorrectly, they're doing something that can make the symptoms worse. Wow. Yeah. So the idea of a pelvic floor contraction is an up and inward motion. Like if you're sitting in a chair, you're pulling your pelvic floor away from the chair and then you're trying to relax it. Mm-hmm. I often tell people, imagine that you have a straw in the vaginal canal and you're pulling fluid up through the straw. It's an up and in motion, right? Not a squeeze, because the squeeze means your abdominals, your buttock, your hands, your toes, anything but. Yeah. Right? So we want to make sure that we're doing just the pelvic floor. And notice I said, and relax, because we have to, when we were talking before about a pelvic floor that's too tight, if you try to do those and your pelvic floor is tight, you can make your pelvic floor tighter and create more issues. You want to make sure you can relax off of every single contraction that you do. That's super important. And the feeling should be like the fluids falling back out of the straw, kind of to get that relaxation. I've stood in front of, 300 people doing a lecture and, see in the audience, like people start to screw their face up and do all sorts of stuff. Like, and they bob in their chair. I'm like, no bobbing, no bobbing. Yeah. So we kind of have to get them to back off this aggressive method of doing a contraction. So it's so important to me that I spend 4 pages in my book describing how to do a pelvic floor contraction and relaxation. So the little warning sign I'll put up to that conversation is that if you have pain, you cannot relax, you're struggling feeling where the pelvic floor even is, and people do have that problem, then you need to go to a pelvic PT. Mm-hmm. That is so important because they will help you find your pelvic floor. They'll help you relax your pelvic floor. They'll help you strengthen your pelvic floor appropriately according to whatever the condition is that you have, right? So it's something really, really important to realize. But most people can get that concept of the contract and relax. And that's huge for starting the right path to helping yourself with a good, comfortable, and strong pelvic floor.
Oh, yeah. Those are such great tips. And two things I wanted to highlight. So the one where you talked about when you do it, but then make sure that you relax. And I think what people will find, because it's very much of a mindful practice, right? Because you're intentionally doing this. And I think you, even when, and because I'm speaking from personal experience too, when I first started meditating, and a lot of the beginning is, relaxing your body. And I don't think how tense many of us are all day long. And honey, you're tense in every part of your body. So chances are your pelvic floor is all like this most of the day. So I think when you intentionally go to do that upward motion, that once you go to relax it, you're gonna be like, holy shit, like I was not relaxed ever. Like, why am I so tight? So I think it's a really great mindfulness thing too, that you're going to engage in, and really just get in touch with your body and how it feels. And I think that's a really important part. That's a lot of what I teach when I'm working with women too. It's like just really starting to listen to your body. And so often we just go, go, go. We're not listening and picking up on the cues that our body is giving us. And so I think it's just a really great way to tune into your body is through that. And that's so beneficial. And I love how you described it. And because I love visuals, girl, I love giving like little visual things when I'm
Awesome.
teaching too. I'm like, visual. So that was great. And then you mentioned hydration and fluid and constipation. So all big things, all big, huge things. And what I'll say about that is a component of what I like to incorporate into my practice is IV hydration. And there are so many really great IV infusions that can help specifically with muscle relaxation, with inflammation. It can help with obviously hydration, keeping you hydrated, keeping things nice and getting all the fluids up in there. But there's also a lot of really great infusions that can help with sensation, with intimacy, with making things more comfortable down there as well. But I think the overall thing is the hydration for sure, because so many people are just chronically dehydrated, or we're drinking water, 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 but not really truly hydrating ourselves in a way that is getting into our muscle, into our musculature, into our muscle tissue, into the tendons and all the ligaments and all those little pieces and parts down there. So I think that's a really great option and a really great something to elevate and add to somebody's pelvic floor routine regimen that can really give them a lot of benefits in the sex department and just the overall feeling good department and everything. And one last thing that you mentioned was the workouts and the exercise. And I totally agree with you there, because so many, I think so many women are focused on, well, I got to go do this HIIT workout. I got to go start CrossFit. I got to do this. And like, they think like that's the way when they don't even go work out in the first place. And I'm like, that is don't even go there. So like for me, when I'm working with women, I like literally just tell them, hey, can you get to 8,000 steps a day? Like, seriously, for like 2 weeks, if you could clock 8,000 steps every single day, then we could go up a little bit, and then we can go up a little bit. But it's just like about getting active, getting moving, walking. Walking so underrated. Just moving in general is so underrated, because we are living such sedentary lives in reality. So many of us are. And so can you just get moving? Just keep it simple and keep it like basic in the beginning. Like just get those 8,000 steps and get your body used to moving and grooving on a regular basis before you go out and like just like shock it by starting to do all these crazy things. Your body will thank you. Just go slow, go in increments. And I think that's really important that you mentioned that not, and I like how you phrased it, because this is how I phrase things too. It's not that you shouldn't do it or can't do it or anything like that. It's, are you doing it in a safe way? Are you setting your body up to be successful, or are you setting yourself up to have more injuries, have more problems, where you're just going to stop altogether and then be back in the same boat you were in before?
Right, right. Yeah, starting slow is so important because if you really have been a couch potato, your body's not going to be able to jump up and suddenly do this wonderful exercise program, and that leads to people just stopping altogether. So you kind of shoot yourself in the foot, so to speak, with it. So I always say to folks, start with that something that's very, very doable. And some people end up doing great programs either at home, they're basic things you can do to strengthen, and then they may progress to a gym, and then they're great, yoga and Pilates. And I mean, there's awesome stuff. And pick what you honestly like to do because you're more likely to stick with it if it's something you like and that's in a doable time frame. For some people, that means going to a gym because they feel like that holds them to doing it. For some people, it's doing something at home. I mean, just do what works. That's how I look at it.
Exactly. So I know you mentioned, we're going to kind of wrap up today's session a little bit, but I know you kind of mentioned earlier the different kind of conditions that women can be like, oh, identify that this could be a pelvic floor issue. When do you recommend somebody seeking out actual help from a professional, where it's like, no, this is not a do-it-yourself situation. Like you need to really get somebody, a professional, involved. When do you recommend that?
Yeah. When incontinence is on the point where if they do the pelvic floor exercises and they feel like they can resolve it and it's pretty straightforward, usually they don't need to go to pelvic PT. But if it's pain with sex, if it's pain that's pelvic through the whole area, we kind of, it's belly button to knee. For me, it's really like, nose to toes. But if it's pain within the pelvic region and it's just not being resolved by other, you've tried other wonderful methods and it's just not resolving, then the question mark should be someone needs to look at the pelvic floor specifically. Mm-hmm. And that could be back pain, hip pain, pelvic pain as a whole. Mm-hmm. Make sure you're going to see a practitioner and a pelvic PT. And then if we're talking about like overactive bladder, a lot of times, someone will be started on medication, but there are loads of side effects to the medications in particular for overactive bladder. And especially for women over 50, they're finding there are a lot of side effects that really are, can really change someone's life, right?
Yeah.
So instead, going to pelvic PT helps very naturally get rid of overactive bladder because it's not just the bladder, it's the pelvic floor contributing to the symptoms. Yeah. So there's such a misconception that overactive bladder, because it's called that, is just my bladder. It's absolutely not just the bladder. Mm-hmm. If you cross over into what's called interstitial cystitis and bladder pain syndrome, those are much more extensive. Those are pain as the bladder fills. Though that is painful. You urinate, you get painful again. Some of those folks go 20, 30, and 60 times a day because they're always in pain. That's something that needs absolute intervention, going to the provider like a urogynecologist, a urologist who specializes in that, and then PT, because what happens is all the muscles in the pelvis start contributing to it. And even if you treat the bladder, these muscles are still all upset and irritated. So we need to combine them. So when someone gets to this pain where they cannot control it with easy over-the-counter or easy exercises, absolutely go to pelvic PT. Fecal incontinence, go to pelvic PT. Don't let that continue to worsen because usually it does over a lifetime. So pelvic PT can catch that a little earlier and get that resolved earlier with great, wonderful techniques and get that person so that they don't progress to the point where it becomes to the point where they can't control it at all. Prolapse is another one. If you feel that bulge, don't wait, go to a practitioner, make sure that's what it is, and get yourself to pelvic PT immediately so you can prevent progression of it, whether that's right after giving birth or later in life, especially during menopause. Doesn't matter. When you first feel it, go, because if you can reverse some of that, what's happening at the musculature, you can really help prevent a worsening of symptoms. So those are, I would say, like the larger bucket of conditions and symptoms you should recognize that you shouldn't wait, to go get that care. waiting is not going to improve the symptoms is kind of how I look at it. If you catch it early, you probably are going to lessen any of the results of it, and you'll improve things for the rest of your life. And that's the beauty of it. You're not just working on what's helping you today. You're learning strategies from the therapist, skills from the therapist, recognition of if something comes back, what do I do about it? So that therapist is teaching you lifelong skills. That's what the book does. It teaches lifelong skills so that you can take care of yourself and your loved one.
Yeah, absolutely. And that's the key, lifelong, because you got your body for your whole life. So you need to take care of it. And, you were bringing up a really great point about the bladder and about how like people might think it's a muscle, and your bladder is cells, it's transitional cells, they're called. And I always think of like a balloon, right? Balloon gets filled, it stretches, and then it contracts like this. And so all those cells, they run on sensors, and that's nerve conduction. And so many times a lot of that nerve conduction can be impaired by other health conditions, and things like type 2 diabetes, high blood pressure, inflammation. Those can all damage the sensitivity, the receptibility of these transitional cells that you have on there. So oftentimes with, the cells start to freak out, right? In essence, and they don't know, like they're going like this, and you've got spasms and all kinds of other things. And yeah, the first go-to is, well, let's give you a pill for that. Let's give you some, oh my gosh, it starts with a P. The name escapes me. The one that makes your pee turn orange that we always give for like the bladder spasms and all of that. Let's give you a pill for this. Let's do that. A lot of those pills have so many harmful side effects. And then you're looking at your liver, and then you're looking at your kidneys and getting those impaired from those medications, when they're, again, going back to some really great IV infusions, like alpha lipoic acid is great for nerve conduction, and glutathione is great for anti-inflammation. So there's all kinds of things that you can use. You can use vitamin C if you're dealing with any type of itis and stuff like that. Can really help with those types of symptoms naturally without having to turn to these medications. Adequate hydration, making sure that your body is fit overall. These are basic things that can have such a huge impact on those other parts of your body. And same thing that kind of goes with what you're talking about, like with the fecal incontinence as well. And I think I'm not going to get too into it, but I did want to mention it because I've seen a lot of women in my practice that have this, where they end up getting like a fistula type situation. So like the opening between the anus and the vagina. And so there's fluids and stuff leaking from one hole, and something's coming out where it shouldn't come out of the other. And women just don't understand that there was a weakening, right, in those muscles down there. And that's kind of what led to this. So along with some other things, but those are muscles, and that's muscle tissue that it's running through. And so it's really important to be aware of what's going on in all the parts of your body. Just don't ignore things. Just don't think that it's because I'm getting older. No, honey, like that's not normal. That's not okay. Go get checked out. Your book is amazing. All the resources. I absolutely love it, love it, love it. Is there some parting words or anything that you'd like to leave us with? And also, where can we find your book? Where can we get it? Let us know.
Sure. So you said something right there that I really love for people to understand, and that these conditions are common. They're not normal. We want to normalize the conversation about it and make it okay for people to talk about all these things that most people are like, oh, I don't know if I want to talk about that. But we want it to be okay to talk about it. So normalize that conversation, not the conditions, because if we feel like, well, yeah, okay, everybody's got, something, but we just have to live with it. We want to erase that whole commentary, right? We want to make sure that people understand that these are treatable, that people do have them, but don't think you have to live with them, right? So that's so huge. And then the book, you can find it on Amazon and on desertharvest.com. And I can give you links if that helps for people listening or reading. It's just such a great way, most people either do Amazon or Desert Harvest is easy to find. And Desert Harvest has some awesome products that help with pelvic floor health as well. So, once you go on the site, there's awesome stuff you can see there. So those are the two ways that you can find it. I have a YouTube. I have 4 videos on YouTube. I'm called the Pelvic Detective, that has some information that helps people understand what we talked about a little bit better. And then you can find me like on LinkedIn and Facebook and Instagram and all over the place. So a couple different places that I post information up, not a ton of it, but just enough that gets people a little bit more, oh, now I understand better about what's really going on.
Yeah.
Yeah. So that's,
Do you
I
have
think that'll be folks.
Do you have a practice? Do you see patients? Do you see clients? What do you have going on?
So I retired a little early from Duke. I was at Duke here in North Carolina, and it was kind of funny how my book was published literally 2 days before I retired. I didn't intend it, but what's happened is it's let me do all the educational stuff. So both clinically treating, and I did a lot of educational things at Duke. So it's allowed me to take the educational component and still help people on a whole different way, rather than just, patient to me. It's now, me to hopefully hundreds and thousands and maybe millions of people eventually. But it's just my great way of giving back and educating and just loving doing that.
Oh, I love that. That's amazing. So amazing. Yeah. Get the book. We'll put the links in the comments. You can go through and put whatever in the comment section, girl. You put all your links to everything that you want, and definitely connect with her on all the different places. Send her a message if you have any questions, or if you're like, hey, I really loved when you talked about blah, blah, blah. Let her know. We love when we're making content like this, we love it when people reach out and let us know their ahas or more questions, because that helps us just be able to deliver better, to serve better when we get that feedback from you. So thank you so much, Ingrid. I really appreciate you so much for being here today. And I'm going to close it out as well. So if you want to connect with me about anything that I talked about, just send me a message. That's the easiest thing to do. Say, Dr. Alex, I saw your video and I want to talk about this. And I got a question about this. The best thing to do. And so we'll close out today's episode. Everybody have a beautiful day. And like we always say here, for balanced life, just add spice. We'll see you next time. Bye-bye.